Let's talk about abnormal scarring. So scarring is a process that we go through, every time, in every case, usually that we make an incision. So it's very interesting how scarring works, because I don't know if you know this or not, but for those patients that have surgery intra-uterine, there's some procedures that we can do before the baby is born, and you can go actually with instruments through the baby's skin to do surgery, certain corrections that we can do inside of the baby. And then when the baby is born, they have no scars, which is very interesting, right? And we believe in the scientific community that it happens because the inflammation is much different in fetuses than it is once you're born, and what happens with your tissues. But we always try to minimize. We always try to use the best available products, both when we do, for example, the selection of sutures that are the least reactive for you to minimize the scarring. We also provide you with silicone treatments, our silicone creams that we'll give you here at Top Aesthetics for the surgery to minimize the scarring. Now, having done all of this and trying to prevent your abnormal scarring, some patients misbehave and they have abnormal scarring. So, things could be a hypertrophic scar, which is a wide scar, or a keloid, which is a thick scar, different. So if it's wide or it's thick. So if it's thick, it means like you have keloid, overgrowth of collagen. When it's wide, your skin elasticity is actually just higher, so your skin will stretch. It happens sometimes when we close under tension, like we do in tummy tucks and things like that. So if any of this happens at Top Aesthetics, we always have these scar revisions available. This is not, for example, dog ears. Dog ears is different. It's called standing cone, and this is the removal of some excess that is left on the corners of let's say, the tummy tuck scar, or any areas that are semicircular or circular, and you close it as a line. So sometimes you can have these areas of a little bit of bulge that we can address later. But when it comes to scarring, we can always do a scar revision. We first will try probably some steroids injections of anything that we can do, so we don't have to go back and reoperate. But if all that fails, then you can come back and we'll do a scar revision, remove the scar, get a new one. And when you have a scar revision, this time usually the closure is done not under tension anymore, so the chances of you scarring poorly are less or minimized. We're still gonna keep a close eye on you because we know that your scarring is probably not the best, so to be on top and make sure that we do anything we can to minimize your scarring for the future. I hope this was beneficial when you're considering the next scar revision with us.